I have a lot of reason to give up, but I never give up. Okay, this is the one of the keys to success. You have to stick in your target and to go for that.
Ladies and gentlemen, welcome to another episode of the Rhinoplasty podcast with me, Dr. Cameron McIntosh. We're in the month of August, which is proudly enabled by Pentax Loops. If you don't have Pentax Loops, you don't have loops as far as I'm concerned. Anyway, reach out to Pentax Loops and check it out. Our guest today on the show, I'm very excited about this. All the way from Israel, Shay Duvdevani. Shay, welcome to today's episode.
Hi, Cam.
So, Shay,
thank you very much for inviting me to your podcast.
Awesome, man. It's so good to have you here. So the first time we met was way back in June of 2018 in Washington, D.C., where we were both nervous wrecks having to write the international board exams of facial plastic surgery. And here we are, so many years later, having been able to attend a congress in Israel and now talking about revision rhinoplasty and all sorts of other things today. So my first question to you, Shay, we were off air talking about this just now. Explain to me at least, the meaning of your surname.
Okay, my surname is Duvdevani is cherry, the fruit cherry.
Yeah.
This is the meaning in Hebrew.
So I can call my wife from now on my Duvdevani, eh?
Yeah.
Cool. Shay.
So, but explain that in Hebrew, yeah.
Yeah, that's amazing. So, yes, I want to. It's so interesting speaking to somebody from Israel. So, tell us as listeners, where did your journey start? Where you've now ended up running congresses and being so involved with the Facial Plastic Society, etc. But it had to start as a young man. Tell us what your journey was and how you ended up being this facial plastic surgeon who's at the top of his game.
Okay, so during my residency in otolaryngology, head and neck surgery, I had a small exposure for facial plastic surgery. It wasn't so common in Israel that ENTs are facial plastic surgeons. Most of the surgeries were done by ENTs or rhinoplasties. And I have to say that this field attracted me very much. So I decided to go after my residency to a fellowship in facial plastic surgery. And I searched for a good fellowship in this field. During my residency, the last year, I performed several rhinoplasties in my department under the supervision of one of my mentors in my residency. And then I traveled to Germany, to Recklinghausen, to a fellowship with Professor Ziegert and Dr. Magritz. Over there, the main surgeries were done with auricular reconstruction and a lot of facial reconstruction and rhinoplasty and all the facelift and everything that is facial plastic surgeries, microvascular surgeries. This was on July 2010. And then I returned to Israel on July 2011. And I started to perform the procedures in Israel, also in the Sheba Hospital, which is one of the 10 best, is graduate one of the 10 best hospitals in the world by the Newsweek. I'm performing there all the reconstruction, some of the aesthetic which are functional, I'm performing also there. and all the rest I'm doing in the private clinic. Of course, after the fellowship, you have the basic, and the main learning begin after you are returning and start to operate by yourself. Because as long as you have your mentor with you, it's not the same. Standing by yourself and start to operate, this is the main issue. This is the main issue. And you have to have a good basic skills with your hands and your mind, and you have to have a connection between your hands and mind. And I think that the previous record of you can add some special aspect to your techniques and attitude to rhinoplasty. At high school I learned architecture, and I am doing a lot of jobs with my hands. I'm sculpturing and painting and doing a lot of technical things. Some surgical instrument I'm doing by myself at home. I have in my garage, I have a special machines to produce this instrument. And then after a few years, I decided to have the board certification. So I started to learn. I had a very big log of operations then, and I started to learn to the exam. And then we met on 2019 in Washington, D.C. at the exam. At that period, I also started to make this congress. The first congress was amazing. After that came the COVID-19 that stopped everything. And now, on May, we have the second congress, actually.
That's fantastic, eh? No, it's amazing how things have grown. And I also think back to World Rhinoplasty Day 2020. There was a team from Israel. So tell me a bit about, like, in terms of colleagues and how big the society is, because you've got quite a small population. But, I mean, as a country, you guys punch way above your weight.
Yeah, we are a young society. We are under the ENT society. This is the top society of our sub-society, facial plastic surgery. We have for now about 50 members in this society. But when we are doing Congress, we have a lot of participants, also from ENT and from other fields. Not all of the members are doing all the facial plastic surgery. Most of them doing a lot of rhinoplasties. Some of them do other things.
And so in your passion within the area of facial plastic surgery, what's your single thing you like the most?
Okay. I like reconstruction of the ears. I'm reconstructing both the aesthetic part and the hearing part. I'm reconstructing the external ear canal and middle ear as well. And a lot of rhinoplasties. This is very, very interesting operation. It's very demanding operation. especially revision rhinoplasty is a demanding operation because you can't control always the shrinkage of the scars from the previous operation, and you have to take it into account when you are operating on a revision rhinoplasty, a revision patient, to try to predict the shrinkage of the scar, and try to avoid it with special ways. If it is with different scars to do, or supporting tissues with stiffer elements like cartilage, it's very important because otherwise you can fail.
So Shay, before we go a little bit more into the rhinoplasty side of things, it's very interesting that you say you actually do like middle ear and hearing reconstructive surgery. So are you doing like otology surgery as well, like different prostheses in the middle ear and cochlear implants, those kind of things, apart from just the facial plastics and rhinoplasty you're doing?
I'm doing the otology only because of the facial plastic, because I'm reconstructing the auricle. And that's why I'm entering the middle ear, and I'm reconstructing a lot of middle ears. And but this is because of my specialty in auricular reconstruction. So if you want to do it good, you have to do it from the beginning till the end.
So in terms of auricular reconstruction and people learning from you, etc., are there any possibilities for people to be able to come and do observerships or fellowships with you?
Of course. I am a program director of the European Academy of Facial Plastic and Surgery. People from all over the world can come and do a fellowship. The period of the fellowship is 1 year. Actually, now I have a fellow, Meir Kuri, is from Israel, but I am accepting from all over the world the fellows. It's a 1 year fellowship. After the fellowship, they can do the examination and get the certification of board certified exam.
That's awesome, mate. So tell us as the listeners, what have been some of the difficult times you've been through in your career? The times where you wanted to give up?
I never give up. Never give up. Listen, this is... I have a lot of reason to give up, but I never give up. Okay? This is the one of the keys to success. You have to stick in your target and to go for that. Go for that directly. And if it's not going directly, you can going above or behind or under, but the target is the final destination.
Wow.
And you have to reach it.
Of course. Okay. Another question. What are some of your most light-hearted or humorous moments that you've had in theatre specifically with patients or in operations or something like that? Does anything come to mind?
Can you repeat the question, please?
I'm saying in terms of funny things that have happened to you.
Oh, in the OR. Okay, so actually I'm hearing music in the OR and I'm concentrating in the surgery, but sometimes, there are jokes that someone speak behind you, and even though you are not part of the conversation, to turn around and to see someone talking and to respond to the joke, this is embarrassing a little bit to the one that were saying it, and it's making the whole team to laugh, and but I'm concentrating in the OR in the patient. So I don't have the time to laugh. Maybe after the operation, sometimes to get a good
good result. That's more important than
no
jokes
good
and
result. We have the good environment. Yeah. So
Shay, tell me, because there are a lot of listeners around the world who are not necessarily surgeons, more on patients who'll be operated. What are for you the key take-home messages after a rhinoplasty that you give the patients to listen to? What is the key things that they need to listen to and do well following surgery?
Okay, so I'm following my patient a lot of time. I'm for a long period. I'm following them at least 1 year after surgery. I see them several times before surgeries. I want to reassure and to know that they know what I'm planning to do, and that they understand everything and all the possible complications and the results. And after the surgery, they are suffering not to lay on the side, because I tell all patients not to lay on the side for 6 weeks. And this is very difficult for them, because of the post-operative crooked, because of the gravitation. They are sleeping with a flight pillow. It's quite difficult for them, but it proved to improve the result of the crooked nose. Because most of people are used to lay on one side more than the other side, and when they are minded to that, they will try and avoid it, and they will sleep less on the side, and it's improved. And close follow-up is very important. Even I'm seeing them 1 week post-operation, 1 month post-operation, 3 months, half a year, and 1 year. It's a lot. Sometimes when the patient has a difficulty with the breathing, I can see them before. Let's say in the first week, sometimes I can see them twice or 3 times, and to clean their nose. I'm not allowing them to touch anything inside the nose, not with a Q-tip or anything. I'm afraid that they will enter with the Q-tip between the sutures and infect the nose, or will take out one suture, and it will cause an asymmetry of the nostrils. It's very important.
Sure. Okay. So Shay, let's come into the topic that you really kind of wanted to talk about more, and that's revision rhinoplasty. So kick us off with possibly, let me think of something to ask you around it, is what are your pearls of the information you would like to bring to our listeners who are doing rhinoplasties in terms of revision rhinoplasty?
Okay, the surgery begin at the pre-surgery consultation. At that point of time, the operation begin. Because pre-operative to decide whether you need to harvest ribs, or you have to harvest concha cavum from the auricle, or you have enough or not have enough cartilage in the septum, and to palpate the nose. This is the first step of the operation. It begins few weeks before the operation, the first time that you see the patient, and then to understand the exact wishes of the patient, to see what he wants. I'm not doing simulation, but sometimes I asking the patient to bring pictures of noses that are desired for them, that they want. And I ask them not.
Sorry, you're not simulating, but you are taking photographs before and after.
Of course. I'm not simulating, but I'm taking the photos before and after. And to understand what the patient wants, I ask them to choose noses of models even that they want. I tell them, choose whatever you want. And then I sit with the photos and the patient and explain them why this nose is suit to them or not suit to them. To make them understand what is good for them and what is not good for them. And the reason that I'm not doing simulation is because, with the 2-dimension, you can reach a very nice nose. But after, inside the operation, when you are operating on the patient, sometimes the 2-dimension and the real life are not the same. You are starting to turn around the patient and to see that it's not suited for him, even though that in the spatial angle that you took the photo, it's looked the same. But when you are looking at the patient, it's not fit his face. So what should we do? Wake up the patient and tell him it's not suited for you. So, and okay, and then after when it comes to the operation, most of the revision rhinoplasty I'm doing in open approach. Some of the revision rhinoplasty, especially if it's mine, that I'm knowing that I know exactly what I have done previously, I do it in a closed technique, because then you know exactly where to go and what need to be done more. And inside the operation, you, as you know, from revision rhinoplasty, you have a lot of scars, and the cartilage are retracted to place sometimes that you can't imagine that they are. Sometimes inside it looks worse than the outside. And then after opening the nose, you have to decide what kind of reconstruction are you doing of revision rhinoplasty. And you have to consider the strength of the scars and the strength of the nose to avoid the contraction of the nose. You have to put cartilage that is hard enough, but not more than what you want. You don't want a too much stiff nose. You have sometimes to use rib. It's not the best choice as I see it. Sometimes to take from the ear cartilage when you don't need the very strong support, you can use a rib cartilage. You are receiving a softer nose. And of course, the shape is the first goal for you as a surgeon. But after the shape, even though the patient is very satisfied with the result, sometimes what's disturbing him is the hardness of the nose. Is the hardest, and then you have to consider what you are doing to make it as natural, not only by shape, also by touching the nose. So you have a lot of things to do when you are doing revision rhinoplasty. Most of the cases you have to enlarge the nose. Most of time, not always, but most of time, the previous surgeon reduced too much the projection, touch the lower lateral cartilage, and they are in the wrong angle. And sometimes there is a too much cephalic trimming of the lower lateral cartilage. It needs to be corrected because it's causing a lot of outside and inside deformities, like pinched nose. Pinched nose can cause also aesthetic problem and functional problem, and you have to support the lower lateral cartilage.
And Shay, how much are you using antibiotics perioperative and postoperative?
I'm using antibiotic only intraoperative. After surgery, only in special cases when I suspect possible infection, I'm using antibiotic. Otherwise, I will not use antibiotic. Most of patient, let's say 90% of the patient are released without antibiotic. And I don't see many infections.
And in terms of the population that you see, is it quite like one ethnic group with a certain like thin or thick skin, or is it quite diverse, the operations you're doing on people?
We have a lot of skin types. We are a kind of immigration countries. We have people that arrived from Europe and from Asia and from Africa and from Arab countries. We have a lot of nose shape and nose texture. You have to know a lot of technique in order to perform a good surgery.
Wow. That's very interesting. So in terms of junior listeners, guys who kind of at the start of their career, what are some of the advice you have for them?
Okay. First, you have to know that this is way of life. You have to live the surgery. You have to love it. You have to love the surgery, and you have to understand your patient to be able to read the patient desire and the future patient wishes, not now before the surgery, what he will want after the surgery. If you see that the patient and all of this is very, very, it's like an art to understand the patient and to stick with your profession. You have to, after that, if you are a young surgeon and want to practice rhinoplasty, you have to sign a target and to go for it. Even if it's hard, you have to go for it all time and you have to find a good mentor first to help you to start, and then you are on your own. The major improvement is by your own. You have to participate in congresses. You have to see a lot of surgeons operating. Performing the operation by yourself as a young surgeon, sometimes after let's say several procedures, it's not adding you a lot of adding value. For example, if I'm operating on a patient which is very complex patient, sometimes if I'm letting my fellow to do this, he will learn less than seeing me doing that. Okay, I'm letting him operate a lot on the public hospital, but sometimes to see the senior surgeon operating, adding you a lot of adding for the learning. I tell them all of our residents and my fellow, look at my hands, how they are moving, how they are holding the instruments, what kind of stretch I am doing on the tissue. How I am holding the tissue, not from the cartilage, and what forceps I'm using. This is very important, because sometimes when you are looking at other surgeon, you can see, oh, it's very easy, I can do it by myself, but but the key for success is beginning at the small things, very small things, and then to try to sculpture on wood and other materials is very important for the imagination of how things are going to sit on the face.
Yes. Well, Shay, that's great, eh? What an interesting, more than half an hour of chatting to you. Such a diverse and interesting human being, eh? So thank you. Thank you for your insights, for the people who've been in the game for a long time, but also for the new guys. It's very inspiring to hear you say that. So on behalf of all the listeners around the world, I want to thank you for this. I want to also give a shout out to Pentax Loops, who enabled this month's the month of August on the Rhinoplasty podcast for all our different guests. And Shay, all the very best for you. Thank you for your passion about rhinoplasty, your passion for fellowships around the world, and everything you're putting into teaching. So thank you for your time.
Thank you, Cam. Bye now.